All right. Thank you all for your attention, and I really appreciate you allowing us to talk to you during lunch. So what Alex and I are going to talk to you about is some studies and on nutrition and health that have come out in the last few years that I think are impactful for both the health of us as individuals, but also things that you can pass on to your patients. I have nothing to disclose. And so, I want you to be able to walk away with some data under your belt, as well as some food rules that actually are from Michael Pollan's book, Food Rules, that can hopefully help you kind of cement that data and make it easier to pass along. This book, actually, Food Rules, with the specific one with the illustrations, is a really lovely book. The paintings are lovely, the illustrations inside. And so if you are at a loss for a gift to get for somebody, I really would recommend this book because it's so pretty to look at. It's visually nice. Okay, so to begin with my food rule, the first food rule is do all of your eating at the table. So your desk is not a table, the counter is not a table, walking while you're eating is not a table. You need to sit down and eat so you can taste your food, chew your food, and enjoy your food. And if you're not eating at the table, then stick to fruits and vegetables. That just comes from, if you've ever had this experience of mindless eating where you sit down in front of the television and you have something to eat and then you look down and it's gone. Where did it go? So it's fine. You can eat all the fruits and vegetables that you want. But otherwise, do your eating at the table. Okay. And then the other food rule to begin with is eat only foods that will eventually rot, because you want to eat food that was recently alive, like Dave said at the beginning of this morning. And things that are alive eventually decompose. Okay, this is the Mediterranean diet. Are people familiar with this? I figured, yeah, okay. Yes, we are, yeah. Are you guys enjoying the food today? Yeah, it's nice. Good. And the reason I chose this pyramid, which comes from Old Ways, is for a number of reasons. As you can see at the bottom, is this the pointer? Okay. At the bottom of the pyramid is a mostly fruit and vegetable-based diet with some whole grains. Moving your way up, there is seafood and fish. Then there's poultry and dairy, and then sweets and meats at the top. Some food pyramids with Mediterranean diets have water at the bottom, which I think is nice. This one, and the reason I chose it is because it shows people eating together, doing things that they love, being with people they care about, which is equally important. And if this pyramid, if they asked me for any updates or like input on this pyramid, I would have kind of the whole background look like it was filled with olive oil, because olive oil is pretty central to Mediterranean diet studies. But here is a study that actually focuses on the Mediterranean diet. It came out of the New England Journal of Medicine in 2013. It's really well powered with 7,000 people being studied over 4 years. And there were 3 arms. There was a low-fat control group where patients were just counseled in low-fat diets. There was another arm that had a Mediterranean diet where they had nuts. Half of the nuts were walnuts, a quarter were hazelnuts, and a quarter were almonds. And they were counseled on how to follow a Mediterranean diet and then have nuts. And then the third arm had some counseling on Mediterranean diet and then olive oil. They weren't asked to lose weight. They weren't asked to decrease their calorie intake. They were just asked to change the way they eat. And that's not a small thing, right? So what we see is that with primary endpoints of acute MI, stroke, or death, that both Mediterranean diet groups had a 30% reduction in risk, which is really impressive. And you can see there really isn't much of a difference between the nut group and the olive oil group. And to be clear, about 30 grams of nuts is about what was in our little baggie of almonds that we have today in your brown bag. It's just a handful. It's not a lot. This is further data from this same trial looking at the beginning, the 1.0 on the y-axis is showing number of people who are disease-free and do not have diabetes, and over time seeing who develops diabetes. And this A and B group are the Mediterranean diet groups, and the incidence of their development of diabetes is quite a bit less by following this diet. Okay, So my next food rules: eat less, stop eating before you're full, buy smaller plates and glasses, and serve a proper portion and don't go back for seconds. And Alex, you might be talking about this, but if you do have seconds, maybe you wait a few minutes and maybe that second portion that you choose is a little bit smaller. And there's reasons for that. So there have been a number of animal studies showing that when there's calorie restriction, animals tend to live longer and be healthier. And so this study, which came out in 2013, I believe, was doing a study on calorie restriction. Now, it's 218 people in the study total, twice as many people in the calorie restricted group than are in the regular group. And the BMIs range from 20 to 28. So this was not a group of people who were overweight, really. But they were asked to cut out their calories by 25%. So if you're having 2,000 calories a day, that's 500 calories less. That's a lot of calories to decrease your diet by, and they couldn't do it. It was too hard. But they were able to decrease their calorie consumption by 12%, which is over 200 calories a day, which is more reasonable, really. And their health outcomes really, really were improved for the better. So here's a picture of just showing how the decrease in patients' cholesterol, triglycerides. C, the HOMA-IR is a test for insulin resistance, and then mean blood pressure over 4 years, which is impressive. Actually, this is just over 24 months. Sorry, 2 years. Okay, this is probably my favorite food rule. Eating what stands on one leg is better than what stands on two legs, which is better than what stands on four legs, or the fewer the feet, the better the meat. So it's just snappy, and it's easy to remember. Okay, I want to talk to you guys briefly about soy. Soy is really complicated. There's a lot of data out there about it. It's a phytoestrogen, and in some tissues it mimics estrogen, and in other tissues it antagonizes estrogen. Phytoestrogens are a lot weaker than the estrogens that we carry in our own systems, okay? And talking to my friends and colleagues, a lot of the concern seems to be with soy and if their daughters should be having it. And the data that I've come across is that soy is actually really protective for girls. And there have been a number of studies. There's this one, there's another one that came out in 2009, and there was an info poem out about it actually, saying that the girls who had the most soy during the time when they had most breast development, so like ages 13 to 15, their risk of developing breast cancer was quite a bit less. And so I would not discourage, if you have any girls in your family, if you have nieces, if you have daughters, if you have granddaughters, if you have young women that you get to care for, it's all right for them to have soy. And it's not something to have fear about. So please feel comfortable educating them about that. Okay, and then to end my discussion, I think it's fine to have treats now and then. I certainly do. And I think that, these foods that are treats or that are things like fried chicken, if you've ever made them yourselves, are a lot of work. And they're kind of a mess for your kitchen. And sometimes they can be rather expensive. And now that we've kind of have other people to prepare a lot of our foods for us, it's a lot easier to get those foods, and it's a lot less work to get them. And so now we have access to them where we maybe didn't before. So another rule that I didn't put up here that Michael Pollan has is you can have all of the junk food you want as long as you're the one who makes it. So if you're willing to put in the effort, then you can enjoy it. But there are things in life worth celebrating, and if you celebrate through a treat like this, I think that's really fantastic. So I thank you for your attention, and I welcome your questions at the end, but I'm going to pass it on to Alex.
Thanks. So, of course, we use a lot of these kinds of rules when dealing with kids in my clinic. I wanted to talk a little bit about something I think that people don't really intuitively understand, which is portion size in this country. Anybody that's been overseas or to other countries and has had different kinds of portions will understand that our portion sizes are usually at least double what they need to be. And lest we think that we're immune, let me tell you, studies show that we are not immune. Lots of good research that doctors and nurses and other health professions are just as subject to this as other people. So one of the food rules is to really try and understand this. So why do we need to be aware of this? So this is my favorite researcher. He does almost all of his studies on the really cheap. His name is Brian Wozniak, and he works out of Cornell. So he does things like invite graduate students and professors to an ice cream social and gives them different size bowls and watches how they eat. He's also the refillable soup bowl experiment guy, if you know that experiment. So those who were given the larger serving bowl served themselves 31% more than those with the smaller bowl. That's amazing, right? These are professional people, and probably also some of them were his grad students. And so this is very true. He also did this with moviegoers in Chicago, gave them free popcorn. Stale, free popcorn, okay? This was not good popcorn. This was stale popcorn. And they were not hungry because they had just come from dinner. They're moviegoers, right? Probably 7 p.m. dinner, right? The ones who were given the larger bucket of, again, stale popcorn ate half as much more than those with the medium buckets. So this is really a problem, right? And again, that's a mindless eating piece of this. If you're sitting in a movie, even if it's stale, somehow it's going down, probably especially if it's an action movie. So who creates these norms? These norms are created for us in the policy arena by multiple agribusiness large companies. And so these larger restaurant portions, larger packages, larger kitchenware suggest that this is normative. In fact, if you go and you buy antique plates, or if you've got a set of your great-grandmother's plates, you'll see that they're actually smaller than the plates that are out there now. So that gets to the sort of French fry experiment with how big the French fries are now. I think that the normal size fries now is what the small fries now is what normal would have been back in the 1960s. Same with candy bars. Those have all changed sizes. And I've noticed this with clothing as well. I have 2 sons that are 10 years apart, and for some reason I kept the older son's clothing and then handed it down to the younger son because my daughter in the middle wouldn't touch any of that stuff at all, of course. And what I noticed was that I could still get him into that same size 10 years later, but then when I went to purchase clothing at the store for this child, I was not able to find things except 2 sizes less. So that actually the sort of supersizing of our kids is happening with clothing sizes as well. And that's been fascinating to me. I just wasn't realizing it was in clothing as well as the plates quite as much. So how do we reverse these norms? Buy the smaller serving sizes, reportion them into serving sizes. I recently got a package of fruit snacks from Aldi's because I go and I shop sometimes at places where my patients shop, hopefully not when they're there because then they think I'm spying on them. So my husband mostly goes to Woodman's. But I went and I got fruit snacks because a lot of kids think that fruit snacks are fruit and they can take them to school and this is a good snack. And this was a package about this big, and it was on the back label, of course, it says 3.5 servings. And if you look at it, it says for lunch right on the front and in very small letters, 3.5 servings. So this is a very, very common thing. You can ask restaurants to do half your order place to go before you get it portioned to you, and you can keep foods and packages off the counter. So this is a very easy trick that patients can use to decrease consumption and also increase consumption. You put the fruit bowl out where it's very obvious people are going to eat that versus if it's hiding in the fruit drawer, whereas the crackers in the cupboard are really easy to get a hold of. So this is some food rules that Brian has that I think are really helpful, and this is the kind of slim by design. So make it convenient to see, to order, to pick up, to consume. So this goes for home as well as out. Make it attractive for kids. It's kind of funny. One of the things that makes food attractive to kids is actually naming the foods. So we call them, dinosaur bites, and they go nuts for that. Or you've seen this happen all the time at McDonald's with the toys, right? So with kids, you can do this at home with broccoli. And for my kids, it was broccoli men, and they look like little men, or broccoli trees, and they ate them and still eat them, even though now they're 17 and 21. But So, and then make it normative to order to purchase to eat. That's kind of normal. He did a wonderful experiment with salad bars and placement of salad bars in school cafeterias. And he physically moved the salad bar closer to the checkout and kind of in the way. So you had to walk past it to get to the checkout. And something like 25% more salads were purchased by kids in high school just from moving where the salad bar was placed. And you can do the same thing with chocolate milk. So you put chocolate milk at the back of the cooler and less of it and more of the regular milk at the front of the cooler. Kids will choose the white milk. So these are really easy sort of things that you can do in your home environment and people can do in out environments and the school environment to make eating healthier. So I wanted to also have a nod to sugar because I think the Mediterranean diet, which is a very low sugar diet, is really important. We've gone way overboard with the low fat diet in our country, and one of my favorite sort of fake foods, besides the Pop-Tarts that clearly I was denigrating in the hallway, this is because one of my researchers is not the healthiest eater, and so we always tease him. Is that sugar hides in many, many foods. And so many foods that are sort of noted as sort of healthy foods, Raisin Bran, for example, or Yoplait yogurts are actually extremely high sugar. And so when a kid comes into me and says, well, we've been really working hard on our diet and we switched and we're now having Yoplait yogurts or 100-calorie packs of cookies, that's mostly 100 calories of sugar. And the same with the Yoplait yogurt. So those are really sneaky, and it's really easy to surpass that limit by breakfast. So. And here's just one nice statistic. Consuming one sugary drink per day, that isn't just soda, but Gatorade, all the other kinds of latte things that we like, increases your risk of type 2 diabetes by almost 30%. So that's an important fact that we need to know. So I wanted to show you some general resources that I use. ChooseMyPlate.gov is the new sort of food pyramid site, and it's I think a little bit better. It's better than when it had the colored stripes, which made no sense to anyone. This is better about how to have most of your plate be vegetables, and that's a nice site for patients as well. EatRight.org is great for your diabetic patients. Our Fit Kids website has a lot of handouts and things on there for kids. And then DHS, Department of Health, has really amazing website with a lot of local resources for obesity prevention in multiple settings. And our Obesity Prevention Initiative will be launching its new website and all of the things that are going to be available and all the coalitions. There are more than 70 coalitions working on this statewide that we work with. We'll be launching in January, and that's going to be called Health Tide. And then, of course, CDC has a fairly decent website as well. Some videos. Weight of the Nation are really nice, easy to get a hold of films about what's happening with the weight crisis in this country. And our clinic is actually featured in the third video, which is nice. Forks Over Knives gets into that really nice piece about how many legs should you be eating and why, and gets into some of the politics of food. King Corn is a great movie about the supplementation of our diet with high fructose corn syrup through corn subsidies, and that's a good one. And then, of course, everybody's favorite classic, which is Super Size Me, which I think when it came out, we wanted to buy it and have it running on a continuous loop at Wingra because we were next to, McDonald's, but we couldn't do it. And then more local videos about what local people are trying to do to improve local food in Wisconsin is preventionspeaks.org, and that's a local website and has really nice little vignettes about backyard chickens and gardening and things like that. So those are video resources. Books I'm recommending, Mindless Eating and Slim by Design by Brian Wasik. He also has the website, mindlesseating.org, which is a really easy to use website and has a lot of little slides like the one I showed you. And then French Women Don't Get Fat, which is kind of a bad title, but actually talks a lot about the enjoyment of eating and some of the gustatory pleasure that people who sit and eat and take time and relax in eating actually eat a lot less. So that is pretty much what we had. And thank you. So we do have some time for questions, I guess, but I'll leave it up to Dave whether that's what we're doing or not. So. Anybody has any questions? No.
One of the nutritionists once told me to counsel parents and tell them, parents choose what children eat and when they eat, and children choose how much they eat. And I thought that was a great rule, and it's worked well for, my children, but also lots of my patients' children.
I think that gets into the empty plate issue that a lot of us were raised with, was you had to finish everything on your plate, and led to children not realizing when they were full, and not having their own appetite control. And I think that is a good rule. I think, but I've seen that also abused, that rule. And what I've seen it is that you can choose what you want to eat, and so sometimes if ice cream's offered, that's all they'll eat. And so they're not learning to taste other foods. And so I always encourage the sort of one bite rule, which is you don't have to, and some kids that are really sensory may just have to have it on their plate for a while before they're able to actually put it on their tongue or taste it. But so that they actually start to taste these things. Because for kids, it takes about 10 tries to like a food if they don't like it initially. And for adults, it's starting to get up into the 15 to 20 range of food. So we have to remember that, once doesn't mean forever.
So I have a couple of comments. One of them fits with a stress thing. We all feel stress. We all feel hunger. Hunger is a perfectly fine thing to feel, and that we really should all be feeling it some more of the time. It's not that painful. The second thing is that if food waste were its own country, I believe it would be the third largest carbon footprint on the planet. And with climate change and ecological devastation going on, I think we should all be mindful about how we can reduce the uneaten food and the lost food, as well as that which we consume.
I think another comment to add to that, Bruce, is that based on the foods that you eat, the amount of organic waste that are produced as a byproduct, such as if you are eating four-legged animals versus working down the fewer-legged animals or the no-legged animals, you are going to have a lot more waste. And even by doing 1 day a week without meat, you make a big difference. Those meatless Mondays make a big difference.
Could you speak to the low-fat versus full-fat, like milks, for example, and how that seems to be a change in philosophy?
Yeah, that's been a tricky one, and I don't think there's good research on that piece. There's a lot of research on low fat, and some of these studies now are coming out more with that may have been sort of a bad thing to do, as you can see with the Mediterranean diet studies. I think for most children, they can tolerate fine, 1%, 2%, or skim milk without any difficulties, and do well. There's a really nice older study that was done with infant feeding, where they switched kids, instead of switching them to whole milk at 1 year, they switched them to skim milk. This was done in the Netherlands, and did just fine with all of the outcomes. However, it was not looking at weight. So I don't know that people have done that from that early age, looking at weight. But what I do see in my clinic in particular with children is that people, when they're trying to have their child lose weight, they will often go to a low-fat diet, which then often means a high carbohydrate, and usually high simple carbohydrate diet, particularly because most kid foods are sort of simple carbs and not the complex carbs. They're not switching to, whole wheat bread. It's quite tricky. And so we often actually have to add fat back into the diet, because they do much better. Most of these kids are insulin resistant, and so do better on a higher fat diet.
Great. Thank you very much, guys. Appreciate it.